Hello, this is Abigail Todd. Thank you for taking some time to view the pitfalls of certainty training. Well, a little bit about myself. I am a nationally certified counselor practicing in the state of Colorado. I am wrapping up my final 6 hours of LPCC pre-licensure candidacy requirements, and then I will be applying for licensure within my state. Needless to say, I am very close to becoming a licensed professional counselor. Additionally, I am a first-year student at Colorado Christian University's PhD in Counseling Education and Supervision program. This is my first professional counseling presentation. I'm sure you've heard the statement, ignorance is bliss. Then how true is that? I found myself at a point of wanting to present this topic because of recently gaining awareness of my own implicit bias and having been stirred up in thought about how this bias conflicts with my core beliefs as a counselor. Beliefs of genuinity, kindness, and fairness to all. This presentation is going to disrupt your blissful state. It is aimed at challenging you to bring awareness to what you didn't even know needed challenging. Are you ready? By the end of this presentation, attendees will be able to accomplish the following. The first learning objective is that attendees will identify personal blinders, narrow viewpoints, and pitfalls for implicit bias. The second learning objective is that participants will be able to distinguish relevant ACAA 2014 ethical codes and considerations related to multicultural considerations related to implicit bias. The third learning objective is that attendees will develop a foundation for core interventions for fighting the impact of implicit bias in their personal and professional lives. Are you ready to get started? So to begin, let's start with some context. What is implicit bias? Implicit bias is defined by Shaw and Bowen in 2023 as the subconscious feelings, attitudes, prejudices, and stereotypes that an individual has developed due to prior influences and imprints throughout their lives. Individuals are unaware that these subconscious perceptions, instead of facts and observations, affect their decision-making. You might be curious as to why this presentation is going to focus on the subconscious and how conscious effort can help change these subconscious associations. It is of critical importance to the counseling profession to challenge these subconscious beliefs because of the ACA 2014 ethical code and because of K-CREP requirements, as cited by Yang et al. In 2023. The American Counseling Association 2024 Codes of Ethics supports the development of counselors' awareness and practices that explore implicit bias testing, as seen in codes A.4a and A.4b. These principles implore counselors to avoid harming their clients and to become aware of and avoid imposing their own values and beliefs, as cited by the ACA in 2014. Additionally, the ACA in 2014 identified that counselors should recognize their own historical prejudices and strive to become aware and address these biases individually and collectively, as seen in Objective E5C. Another reason for highlighting this unintentional, non-conscious process is that there is limited diversity in the counseling profession, with the mean age of the average therapist in the United States being 41 years old. Additionally, the population of therapists in the United States is 75% women and 75% white, as cited by the Treetop in 2024. Yet, Conroy et al. 2021 identified that in 2019, the predominant population that engages in mental health services are bicultural people. This presentation is going to focus on how to grow your multicultural competency related to your subconscious thoughts and beliefs. Research related to implicit bias reveals that everyone is impacted by these biases and that they've generally developed based on personal experience, as cited by Ugrofsky 2020. Therefore, thank you for attending this conference. And as a counseling educator, counseling student, or counselor, you're going to be addressing some of these implicit biases in your own life. However, fear not, because this is a safe space and this presentation will continue to uphold respect and kindness for all throughout. As counselors, we're called to create an environment of non-judgment and unconditional positive regard. How can this be done if our clients, peers, and community perceive our behavior as biased, prejudiced, or hurtful? Counseling professionals are inherently oriented towards human justice and social advocacy. Therefore, when facing unconscious prejudice and microaggressions and neuroaggressions, dissonance can be common, as cited by Luke et al. 2020. Therefore, self-reflection is an important aspect of gaining counselor awareness as it relates to implicit bias. In this presentation, we'll challenge counselors to question how their certainty impairs a growth mindset and identify areas of their own rigidity, as well as develop skills and interventions to apply to this newfound knowledge, skill, and practice. I'm going to move my video around, put myself down here. Okay, so as it relates to the key concepts and insights, first, it's important to address Harvard Project's implicit association test. That's a lot of implicits in case you didn't catch that. And in 2011, Harvard created this project in order to identify how people associate their implicit biases. It's important to remember that explicit bias and implicit bias are clearly very different. As you can see in the infographic above, there is a list of how explicit biases are direct, conscious, and relate to discrimination and prejudice, versus implicit bias are unconscious attitudes and beliefs and are things that people aren't even aware of. However, they can impair judgment, behavior, and feelings. Therefore, utilizing the implicit association test by Harvard is a great skill for gaining awareness of how implicit bias might be affecting you. The implicit association test has 18 subcategories that measure different things related to a person's identity, such as skin tone, race, religion, politics. An example of this is an implicit bias test related to weight. On the implicit bias test, there will be objectives related to thin and fat people and understanding how you associate thin or fat with your biases such as good, positive, negative, unhealthy is going to help you better understand how you might interact with counseling clients, or as a counseling professional, how might this impair your ability to work in a community-based setting? And as a counseling educator, how is this impacting potentially your work with students? Gaining awareness is the first step to understanding these hidden biases, and therefore it would help reduce their impact. It is important to note that Charles Worth et al. 2022 did did find that the AIT tests were not reliable for non-English speaking and international people. Despite this research, Sargent and Newman 2021 found that the AIT was used on police, was positively correlated with their experiences related to explicit bias. Therefore, they used this tool to measure how implicit and explicit bias were aligned, and they found that it was aligned, therefore suggesting credibility for using the implicit associations test as a way to measure implicit bias. The ACA 2024 discusses difficulties related to Black men getting therapeutic treatment. Additionally, research by Mario et al. 2018 suggests that this could be related to implicit bias, explaining that after studying a phone survey in counseling offices, white women got the fastest calls back to start therapy, and Black men had been historically diagnosed with disproportional rates of schizophrenia. Additionally, due to the long-term nature of mental health treatment, trust and rapport is very significant in importance. Therefore, if a therapist's implicit bias gets in the way, it can increase marginalization of vulnerable populations. Additionally, this graph down here talks a little bit about the disparities related to the impact of how, when therapists have implicit bias, their implicit bias impacts their patients and causes disparities in health. So you're wondering, probably, what are some possible solutions to implicit bias if we all have it? Okay, so to discuss how we might address the interventions for implicit bias, we're first going to look at Boyer 2022's work. Boyer 2022 created a 13-step process for a cultural audit. The cultural audit first reflects on the counselor's own cultural experiences and then works to create a collaborative and culturally sensitive working relationship. This is an awesome idea for integration so that implicit bias can be challenged. The second intervention is created by Ivers et al. 2020, and the researchers found statistically significant results in which counselors who practice mindfulness had lower implicit bias scores. The third suggested intervention is proposed by researchers David et al. 2020, which states that the use of consultation aids in the reduction of implicit bias. Similarly, the fourth intervention, research by Wiley and Blackwell 2022, supports supervision and consultation as a method for addressing implicit bias in counselors. The aforementioned interventions shall help counselors address implicit bias if utilized. However, busy counselors need to dedicate time to practicing and implementing these interventions to affect change. Is anyone willing to make that commitment now? Is there apprehension about committing to utilizing these interventions? I propose taking a few minutes to select an intervention you would like to focus on and consider how you might find space to apply it to your practice. Though implicit bias and explicit bias have clear differences, research by Charlesworth et al. 2020 reports that there can be an overlap in themes between bias. With this, it is important to consider how implicit bias measurement and interventions would be possible without addressing explicit bias. Therefore, once awareness has been created, it is important to maintain a flexible mindset and be open to challenging one's biases. Mario et al. 2018 suggests that more interventions are needed to challenge implicit bias. The benefits of addressing implicit bias is that you, as a counseling professional, will be increasing your multicultural competence. Multicultural competency is not a one-time achievement and takes ongoing reflection and development To address, by addressing implicit bias through awareness and intervention, counselors are engaging in a growth mindset and integrating counseling values of respect and human dignity for all. Oops, sorry, let me go. Sorry. This is another great graph that has some additional supports for addressing implicit bias, including continuing education, which you're doing now, diversifying your network, practicing mindfulness, challenging stereotypes, slowing down decisions, and also suggest taking the implicit associations test. Okay, so to conclude, some of the main points are implicit bias is a set of unconscious beliefs about a group of people that results in behaviors and beliefs being associated with the entirety of that social group. Payne et al. 2017. Implicit bias impacts everyone. And the first step to addressing it is bringing your own biases into awareness. I suggest checking out Harvard's Project Implicit 2011 implicit associations test, which has over 18 tests for measuring implicit bias relating to identifying characteristics. As counselors, counseling students, and counseling educators, we are called by the ACAA Code of Ethics 2014 to challenge historical prejudices and strive to become aware and address these biases individually and collectively, as seen in E5C. There are 4 main interventions proposed during this presentation. Boyer 2022 proposes using a cultural audit. Ivers et al. 2020 proposes using mindfulness. Davis et al. Proposes using consultation. And similarly, Wiley/Blackwell 2022 proposes utilizing both supervision and consultation. How can you commit today to creating time to create awareness for your own implicit bias and challenge this bias through mindfulness, cultural audit, consultation, or supervision? Lastly, is there any questions related to the content covered in this presentation today? My final slide is a review of the references that I used to create this PowerPoint. Thank you so very much for taking some time to review my PowerPoint and my presentation. It's been great to spend some time with you today.